So this video is going to talk about bone fractures. So bones are usually healthy and strong, and they sustain us with movement, etc. However, due to some form of trauma, vitamin A deficiency, low bone density, or being old, bone fractures can occur. Bone fractures can lead to tears in blood vessels, which carry nutrients to the bone, which will cause some problems. But our body obviously has some mechanism to repair bone fractures. Now, bone fractures itself can be categorized into 4 parts. Can be classified by the position of the bone ends after a fracture, can be classified of the completeness of the fracture, the break, the orientation of the break, or whether the bone ends penetrate the skin. So position of the bone ends can be classified under 2 types. In non-displaced, the bone's position does not move. However, in displaced, as you can see by this diagram, if I draw it okay, you can see that the bone moves, and this is displaced because the bones are displaced after the fracture. The completeness of the break essentially means whether the bone completely fractured or incompletely fractured. So whether it incompletely doesn't break off or it completely breaks off. Now, the orientation of the break, what it means that whether the fracture is on a vertical axis or a horizontal axis, also known as linear or transverse. Penetration of the skin is obvious. A fracture that penetrates the skin will cause a compound fracture, and one that does not penetrate the skin will cause a simple fracture. Okay, let's just learn more about bone fractures. Let's just say a kid fell down and broke his fibula or tibia, for example. So now, what happens to the bone? Let's zoom into the bone and learn how the fracture repairs itself. So here is a bone, a typical long bone. Contains the periosteum, which wraps around the bone. This is the fracture. We have the compact bone and the hollow tube, which is formed by the compact bone, and we also have the spongy bone. We have blood vessels here, and blood is formed and accumulates in the body. This is just after the fracture. However, a few seconds, minutes after the fracture, we have major swelling. Here's a fracture again. This stage is known as the hematoma stage, or where the hematoma formation begins. And essentially, the hematoma formation is when blood accumulates, forming the hematoma. And this causes a death of some cells and swelling and pain associated with the area. And as you can see, the vessels are damaged here. After a few days, the bone will go to the second stage, known as fibrocartilaginous calla stage, or the fibrocartilaginous callus formation, the soft callus formation. So the blood vessels here are regrowing. We have new blood vessels forming, and a type of meshwork from granulated tissue forms the callus. And also outside the fracture, where the periosteum is, we have the external callus being formed. So the granulation tissue fills in the gap where the fracture is and rejoins the fractured bones together. And this is what the soft callus essentially does. Then after a few weeks, the fractured bone will enter the third stage, which is the bony callus formation stage. Now this stage, the bony callus formation stage, is when the soft callus, previously formed, will then become a bony callus. And we have new blood vessels here. And here now we have the bony callus, which is formed with the help of also other tissues in the area. So soft callus converts to bony callus in this stage. Then after several months, the bony callus will remodel to become fine bone. So this is the bone remodeling stage, where the bony callus is remodeled to become strong new bone. So healing occurs. And the compact bone is laid down, and osteoblastic activity also is increased during this stage. So essentially, the previously fractured bone is now completely healed after the 4 stages. Hematoma stage, fibrocartilaginous callus stage, the bony callus stage, and the last stage, which is the bone remodeling stage. Let's talk about osteomyelitis now, which is related to bone fractures. So what is osteomyelitis? Well, osteo means bone and myelitis means marrow, and we'll see the relationship why. Osteomyelitis is when a bacteria, specifically a Staphylococcus strain, can infect a bone during a bone fracture or through the bloodstream. And once this bone has been infected, the person will start feeling severe pain, sweating, and also swelling of the bone injured site. And what this bacteria usually infects are long bones, the ends of long bones. And at the ends of the long bones, the bacteria will cause necrosis of the bone cells. So the bone cells begin to die, and there's also pus being formed, and essentially this previously strong bone will become weak. Not only that, but if this condition is not treated as soon as possible, the osteomyelitis can become chronic and a lot of bone cells can begin to die, and this can have serious consequences. And this black patch is the infected area, for example. And the cause of osteomyelitis, as I mentioned, is Staphylococcus, but particularly this type Staphylococcus aureus. So once this bone has been infected, there are some serious changes. First of all, pus can be formed by the infected area because of immune cells trying to neutralize this problem. So pus formation. And it moves out of the cavity and pushes the peritoneum out. And essentially, after a while, what this would do is that new bone formation could possibly occur because the bone cells around that area will think that the body wants to create new bone. But essentially, osteomyelitis actually causes bone death, specifically at the ends of long bones. And that is why osteomyelitis is a very serious condition. So that concludes this video on bone fractures. We talked about bone fractures, the types of bone fractures, how bone fractures are healed, and we talked a little bit about osteomyelitis. I hope you actually enjoyed that short video. Please comment, like, and subscribe.